Hi, I'm Frances Lockery. I work with Scottish Care and my role is Digital and Technology Development Officer. Well, this role is out with the normal Scottish Care role in a sense, in that it's a government funded exploratory project that I am coordinating and managing on the ground. And the focus is on how we can develop roles moving forward that include the use of technology in care at home settings? Well, the project's aim is twofold. One is to explore the potential of a new role in the sector. That was on the back of previous research that had been done by Scottish Care with Glasgow School of Art back in 2017, where they looked at future workforce, because we've known for some time that within the sector there is an issue with inviting, enticing and retaining staff. And then, of course, the other aim is how would a role like this and the inclusion of technology in the actual care received by those who require it, how is the impact for them? What is it that's meaningful for them? And we're still gathering data around that. We've also discovered some of the issues for people around committing to having that as part of their care provision. There were a couple of different responses. One was caution, a very overprotective, cautious response. And then there was, of course, staff hesitancy around their own ability to understand technology and how that would interact with the care that they already deliver. SRS, in conjunction with one of the partnerships, Arms at Length organisations, are setting up a tech suite within their own premises. Now, the care technologists will be in situ there at times for certain appointments that people make to come in. And it's really like a walk-through room of very sort of daily tasks and activities that people would do, but with the aid of technology and technological devices. And so because this is in situ in their offices, that will also provide another way of sharing what's going on with the staff within the organisation. And it's also to get away from this idea that it's an add-on, that it's an option to speak about. It's actually going to be integrated and embedded in the assessment. And that doesn't mean, like I was saying, that people have to take technology as part of their care package, but it means that it's part of the early discussion, and that's important. I think that part of the exploration of this is going to see how it develops. It's very much an evolution. I think that as we go through the project, as we gain feedback, and as we create and develop the descriptor of the role and how it links with other members of the team, of the care team, I think that will become more evident. But I also think that there's perhaps a wider implication as well in terms of where our focus was originally, which was in developing the future workforce within the sector, is that we're looking at creating different pathways as well within that career choice. We're looking at how we can diversify the people who are attracted to the sector, to work in the sector as well, so that we can build a really robust workforce moving forward. I think a piece of advice that I would have given myself would be to actually really suss out what else is going on around the country, because I think there's a lot of great work in this area that we possibly weren't aware of. So we might have reinvented some of those things and we could have actually started at step 3 instead of step 1, perhaps. So I would definitely say get into any network that there is where discussion on this subject is going on. And I know that there are a number of them coming online, which I think is going to be phenomenal in helping to share this information. I also think that it's so important to share the information as broadly as you can within the organization. Make sure that everybody understands what the real focus of it is. It's not about the technology, it's about care delivery. And that, I think, helps to bring people on board, because that's what they're there for. That's why they're in the sector, because they want to help people and deliver care as best as possible.